afternoon, Your Honor. My name is Chen. I'll be representing the plaintiff, Jamie Morton.
Good afternoon, Your Honor.
Good afternoon, Your Honor. My name is Hugh Pemberton. I will be representing the defendant, Dr. Ramidus.
Good afternoon, Your Honor.
Can I start with my opening, Your Honor? Your Honor, opposing counsel, members of the jury, my name is Chen, and I'll be representing Jamie Morton for this trial. Jamie Morton is a swimmer. He's a good one. He's one of the fastest runners across the country. But in the middle of one of his races, well, something went wrong. His legs started hurting. He couldn't swim. He screamed out in pain, and he knew in that moment, he knew he would never swim again. Defense, they're going to tell you a lot about the race. They're going to tell you that until that moment, Jamie Morton, he was fine. They're going to tell you a whole lot about why that race ruined his career. But members of the jury, they're focused on the wrong race. You see, 8 weeks before that meet, Jamie Morton was in the hospital. He had torn his ACL swimming, and he asked Dr. Ramidus to fix him. He put his safety in Dr. Ramidus' hands to fix him. Now, you're going to hear today that there were 2 surgeries that could be done on Mr. Morton. One that was safe and one that was fast. Dr. Ramidus, he fixed him, but he wanted him out of the hospital as quickly as he could. He did something called an allograft. That's when you conduct a surgery utilizing skin from a dead body instead of a host. Now, Dr. Ramidus will tell you that procedure is not as safe as what they usually do, but it's quicker. And members of the jury, Dr. Ramidus was racing to save him. That's why today's case isn't about the race that put Jamie Morton in the hospital. The defense will tell you that it is, but members of the jury, they're focused on the wrong race. Today's case is about Dr. Ramidus' race, to get him out of the hospital even though he knew that doing so was dangerous. Thank you.
Thank you, Your Honor. Today's case is about impatience, not imprudence. Ladies and gentlemen of the jury, opposing counsel, Your Honor, Ms. Chen just told you a story. A story about an imprudent doctor, Dr. Ramidus, whose lack of care resulted in the career-ending injury of Jamie Morton. She claims that this doctor's medical malpractice was the cause of the injury. She claims that Dr. Ramidus prioritized speed over safety. But today, I'm going to show you why that's not the case. You see, Jamie Morton was reckless and impatient in his recovery. He pushed the limits of his injury, refusing to listen to instructions from his physical therapist, and he resumed activity far before what was appropriate. Jamie saw that his own beliefs around recovery trumped that of medical experts, and through his stubbornness and lack of patience, he re-injured his ACL, thus effectively ending his career. Now, the plaintiff is bringing a claim of negligence against Dr. Ramidus. Negligence through medical malpractice. And that means that they have to prove to you 2 things. 1, that the doctor was imprudent, meaning that they did not exercise a degree of care that was appropriate. And 2, that this failure was the cause of the damages. And today, the burden of the proof lies with the plaintiff, which means that they have to prove to you by a preponderance of the evidence, meaning by more than a 50% chance, that Dr. Ramidus is liable. But the plaintiff won't be able to do that because Dr. Ramidus acted within a reasonable degree of medical care, and his actions were not the proximate cause of Mr. Morton's injury. First, let's talk about Mr. Morton. He was a D1 athlete, someone who always pushed themselves through intense physical activity, someone whose physical fitness was very important to them. In the face of his initial injury, Jamie wanted to get back swimming in the pool as quickly as possible. After the surgery, Jamie was antsy to get back into the water. He wanted to get back to swimming immediately. And when Mr. Morton is on the stand today, you will see how his impatience led to his re-injury. You see, Dr. Ramidus had sent him to a physical therapist, Robin Stahl, for his recovery. And Jamie was advised to stick to the recommendations of his physical therapist as closely as possible. But he did quite the opposite. He pushed himself too hard and got into the pool far before what was recommended to him. He was told explicitly not to do so, but he did anyways, believing that it was best for his recovery, taking his own beliefs over the medical expertise of his physical therapist. And ultimately, this resulted in Jamie's re-injury, his ACL being torn once again, and sadly, that meant the end of his athletic career. After the fact, Jamie was understandably upset, but he looked for somewhere to place blame, and that place ended up being Dr. Ramidus. Today, I'm going to call Dr. Ramidus to the stand, a board-certified orthopedic surgeon with a plethora of experience. And he is going to tell you how he followed normal medical procedures, acted with prudence, and executed the surgery to an appropriate standard. He's going to show you that while there was a slight error in the operation, it had negligible effect on Jamie. And most of all, he's going to show you that it was not his own imprudence that caused Jamie's re-injury. And that's why today's case is about impatience, not imprudence. Thank you.
Your Honor, I would like to call Jamie Morton to the stand.
Good afternoon, Your Honor.
Please state your name and occupation for the record.
Good afternoon, ma'am. I'm Jamie Morton. I'm a student down at University of Minnesota. I was their star swimmer before everything with Dr. Aldi happened.
How did you get into swimming?
Well, I've always loved the water. I mean, even when I was little, I'd fill up the bathtub and do laps, But if you're talking about competitively, I joined a club team called USA when I was a bit older. And then I joined the high school when I was about 7th grade. They let me in early because I was real good,
Did you do any other sports?
Yeah, I did like karate and soccer and all that. But when I was about 10, I kind of decided to start dedicating myself to swimming. I just felt real blessed that I found my passion so early in life,
How was your high school swimming experience?
Oh, it was real great, man. I mean, some of the best years of my life. I was real close to all the swimmers. They got to tell me a whole lot about, just endurance and talent. We blessed a lot of them.
And what else did it teach you?
Well, they got me real interested in nutrition, I became a bit of a health nut in high school, I'd say.
What do you mean by that?
Well, I kind of wanted to be a role model for the young kids in the team, like those kids were to me. So I started caring a lot more about what I put in my body. I was a lot more careful, I didn't go to parties, I didn't do alcohol or drugs or none of that.
Did your swimming career go far after high school?
Yeah, I went D1 with University of Minnesota. I mean, they were already talking to me my junior year about it, but it was real exciting. Got a full ride and everything, but I guess I don't have that anymore because I got it because of my swimming, and that's not really something I can do no more.
I'm sorry. How was your experience on the swim team for the University of Minnesota?
Oh man, I loved it. I mean, I basically got to live in the pool. I was the first one in. I was the last one out. They were even electing me co-captain when I was a freshman. I mean, it's probably the happiest I've ever been. I just wish I could go back.
Why can't you?
Well, Dr. Ramidus, he botched my ACL surgery. That's what they say. Didn't do it properly. Now they're telling me that I can never swim again.
And how did you injure your ACL?
Well, I was swimming in this meet before the Big Ten championship. It's this real important swimming event. And I was on track to get a new PR, personal record. And well, I kick off and I hear this pump in my left knee. And well, it don't start kicking right. It starts hurting real bad. All of a sudden I'm in there, I can't swim no more. I start flopping around like a fish. I mean, they had to pull me out of the water.
What happened next?
Well, they take me to this university healthcare clinic. The doctor told me I had this thing called breaststroker's knee, but I knew my body. I knew this wasn't no breaststroker's knee. This was serious.
And why is that?
Well, I've been studying technique since I was about 12. I mean, I'm the one that teaches people how to prevent breaststroker's knee. I knew that I didn't have it.
And what did Dr. Ramidus do?
Well, Dr. Ramidus, when I got to him, he ordered an MRI. Turns out I was right. I had torn my ACL. He told me I'd be fine, but I just needed to listen to him and do some surgery he talked about. I said that he should do whatever he needs to do. I just wanted to make sure that I was safe. He said to do some PT before the procedure, and then I'd be able to swim again, no problem.
Did he tell you anything else about the procedure?
Well, he told me he wasn't going to do it the usual way. I didn't really understand what he was saying. He was using real big science words and stuff, but what I do know is he said it wasn't any more dangerous than the other procedure, what they typically do, so I told him I was fine with it.
And what happened after your operation?
Well, after I agreed to anything Dr. Ramidus told me to do, he put me in a knee extension for about 6 weeks.
And when did you get back into the water after that?
In about late March, my incisions had healed real fast, so I got into the water, just kind of flowed there for a little bit, helped with the stiffness and the soreness and stuff.
And did the swelling and stiffness stop?
Well, not really. I mean, even after about 8 weeks, I was still having problems. But well, they told me I'd be good to do dolphin kicks and flutter kicks, get back to practice a little bit, so I did.
And after you started to go back to swim, did anything happen?
Yeah, about 2 weeks later, early May, I was swimming. I was doing the dolphin kicks like they told me I could, and well, I hear that pop in my knee again. And man, this one it hurt even more than the last time. I mean, I was screaming it hurt so much. I was just praying that this leg it wouldn't stop me from swimming any more than it already had,
And what did you do next?
Well, I went right back to Dr. Ramidus. I mean, he did another MRI, said I tore my ACL again. I listened to everything he said. I didn't understand how this could have happened.
And did you have another surgery?
Yeah, but I made sure to get it with a different surgeon. Didn't have no problems after that, but they said I can't ever swim again.
And what does that mean to you?
I mean, it basically means my life is over. I lost my scholarship, I lost my passion, I lost my future career, man. I lost everything. Now look, I didn't want this to happen. If Dr. Aldi had told me to do something different, I would have, I swear to you. And I'm not the one that likes to blame the people trying to help me, but Dr. Aldi, he took shortcuts when he was doing my procedure, and that's the reason I'm here today.
Thank you, Your Honor. No further questions.
Permission to approach the witness, Your Honor. Hello, Mr. Morton.
Good afternoon, sir. You doing well?
Hi, thank you. You had your surgery with Dr. Ramidus on February 22nd, 2021, correct?
That sounds about right, yeah.
You wanted to have the surgery so you could get back into the pool as fast as possible, right?
Well, I wanted to make sure my leg was healed, but yeah, I guess you could say that.
And you stated in your affidavit that Dr. Ramidus used a lot of big words to describe the procedure, so you just agreed to whatever he recommended?
Yeah, big science words. I didn't really know what he was saying.
You complained about the use of the allograft in your knee, correct?
Yeah, that's right.
But you consented to it, right?
Well, I consented to it when I thought that it was safe, sir, but I didn't know I was going to be back in the hospital 8 weeks later.
Now, post-surgery, your physical therapist told you that you should wait 6 weeks before getting back into the water. Isn't that right?
You said to wait about 6 weeks before I started swimming, sir.
Well, now, but that would have been around the end of February when he told you that, right?
Yeah, he probably told me that around then.
So 6 weeks later would have been around mid-April, right?
I'm not sure. I think that sounds about right, though, yeah.
But you got back into the pool in March, right?
I got back into the pool, sir, but I made sure not to swim.
Well, when your physical therapist found out what you had done, they had made, in your words, a big deal out of it, right?
Yeah, he was a little annoyed about it, but I assured him I wasn't swimming.
Well,
I was just, staying in the water.
That's because they thought it was a detriment to your recovery, right?
Yeah, they thought I was swimming.
Hearsay?
It is stated in Jamie Morton's affidavit that this is what the physical therapist stated to him, that they recommended for him to do this because otherwise he may have get injured.
May I respond, Your Honor? Just because it's in Jamie Morton's affidavit doesn't mean that he can testify it. It's still an out-of-court statement.
I mean, this was rationally perceived by Okay, this was Jamie Morton's own telling of the events that happened that day. The way that he received the advice from his physical therapist, these words aren't coming straight from his physical therapist, but rather what Jamie Morton said in concern to him.
May I respond? Jamie Morton is saying something that the physical therapist said, and the physical therapist isn't here to testify or confirm or deny these claims, so that's an out-of-court statement.
I'm gonna sustain the objection.
Thank you, Your Honor.
Thank you, Your Honor.
Well, still, you didn't listen to your physical therapist's advice because you thought, you were impatient around your decreasing fitness, right?
That's not true, sir. I listened to what the therapist told me.
But, you went into the pool before they advised you to, correct?
I was told not to go swimming around. I didn't do anything with my legs, sir. I got in the pool and I worked with my arms. I swear to you.
Well, the physical therapist was also frustrated that you were pushing too hard in your rehabilitation, right?
That's because they thought I was swimming around, sir. I understand it. He was a little confused, but I wasn't using my legs at all.
Well,
Objection, Your Honor. Relevance. Right now, opposing counsel is questioning my witness about the physical therapist, who is not defendant of this case today.
Your Honor, I am trying to establish how Jamie Morton did not listen to the recommendations for his rehabilitation and how that resulted in his re-injury. I think that this is one of them.
Yeah, thank you, Your Honor. Your Honor.
So they were frustrated with this because you were pushing too hard during rehab. This was not when you were in the pool. This was strength training. Isn't that right?
I'm sorry, sir. That was a real long question. Can you read that?
Yeah, sure. So they thought you were pushing too hard in your rehabilitation outside the pool and your strength training. Isn't that right?
Yeah, they said something about that.
And still, you didn't think that their advice was correct because you thought that you should get the joint moving more because that would permit you to recover faster, right?
Well, no. I wasn't saying they were wrong, sir. I wasn't.
But nevertheless,
pushing my
you didn't
leg.
listen to them. Still, correct?
I listened to what I was told to do, sir.
But anyway, a few weeks after that, you started to swim full time with the team, right?
I started swimming when they told me I could, sir.
Well, the physical therapist was frustrated with that, but nevertheless, a few weeks later, you re-injured yourself, correct?
Yeah, I was doing butterfly kicks. They told me I was allowed to do.
Well, you stated, Your Honor, wait, are you sure that's what you're testifying here today?
Yeah, that's what I'm saying today, sir.
That it was when you were doing flutter kick that you tore your ACL?
Yeah, I was doing dolphin kicks, sir.
Your Honor, I would like to approach the witness with their written statement. Well, actually, if I could direct the jury to lines 147 and 148 in Jamie Morton's affidavit.
Objection, Your Honor. Oh, wait, actually,
Mr. Morton, can I have you read this sentence starting from this line to here?
Yeah, of course. About 2 weeks later, early May, middle of a club workout, I felt that horrible pain again that I felt back in January.
Okay, so you say that it was during a club workout that you re-injured this, right? That would have been you fully swimming, right?
No, sir. A workout, I meant, like a warm-up. We were swimming. You can actually swim while doing butterfly kicks, sir. I'm a little confused.
Well, if I have this correctly, sir, the rehabilitation that you were doing at the time was not using your legs, correct? Beforehand, you stated with the butterfly.
But before they told me I could do butterfly kicks, sir.
Well, nevertheless, you were doing a full-on club workout when at the time, and you just testified that you were simply just doing flutter kick at this point, right?
Yes, sir. I was doing butterfly kicks. It was part of the workout.
But so you don't think that your actions concerning your recovery played any role whatsoever in your re-injury?
Look, if they did, I only did what I was told to do.
No further questions. To call Dr. Ramidus to the stand. Could you please state your name and occupation for the record?
Yeah, of course. I am Dr. Aldi Ramidus. I am an orthopedic surgeon and a licensed medical practitioner in Minnesota.
Could you give some background on your career?
Yeah, after high school, I went to Northwestern University and I got a BA in biological and physical sciences. I also did pretty well on my MCAT, so I got to attend the University of Minnesota Medical Center. I then went into orthopedic surgery residency, and after 5 years of that residency, I became a board certified orthopedic surgeon.
Could you please explain what orthopedics is?
Orthopedics is basically a branch of medicine that focuses primarily on the care and musculoskeletal system. Basically, that means it's muscles, bones, and the stuff that connects muscles and bones together called ligaments.
Your Honor, I would like to establish Dr. Ramidus as an expert in orthopedic surgery. So, could you please describe why you're here in court today?
Yeah, I believe the defendant, or Jamie Morton, is suing me for my negligence over the alleged medical malpractice in regard to the ACL reconstruction surgery.
Well, what is ACL reconstruction surgery?
Well, basically, the ACL is one of the 4 major ligaments in the knee joint, and it basically is the main part when you stabilize your knee. And in this surgery, I make 2 small cuts, which I call incisions, incision A and B. And I use the surgical instrument to look inside of the knee. I then replace that torn ACL with a new graft. Graft is another type of ligament that replaces the ligament that was torn. With proper recovery, the joint can resume as normal.
How much experience do you have in this procedure?
I have performed over 90 surgeries on torn or injury ACLs, and I've looked on many other more. I've looked on hundreds during my residency and during my time as an orthopedic. I am very familiar with both the injury, the surgical protocol, the surgery, the rehabilitation period, and the medical standards of care. I basically know it like the back of my hand.
Well, when was Jamie Morton brought to you as a patient?
Yeah, I first saw him on February 4th, 2021. Immediately I knew something was wrong, so I ordered an MRI, which is a magnetic resonance image, and I confirmed the diagnosis of a torn ACL.
Well, how did your consultation with Jamie go?
Yeah, we had a sit down, we looked at the MRI together. I told him all the options, I told him about the allographic, the hydropathic, and I told him the risks of both of these surgeries. I told him what the benefits of each surgery were, the healing period, all of the caveats in both of the surgeries. Ultimately, Jamie, he agreed to do the ACL reconstruction surgery using the allograft itself.
Well, what's an allograft?
As I mentioned before, there's the grafts, and a specific allograft is a type of graft, a replacement tendon, and it's taken from the body of another person, deceased. The alternative is an autograft, the other one that I offered to Jamie, and unfortunately this is a graft taken from another tendon in the patient's body. I decided that it was a little bit worse as for Jamie, as he was an athlete, and I thought it could present a potential risk to Jamie's future as a professional athlete. Jamie, after my referral, also agreed to do the allograft and he seemed to know what was going on.
Well, how did you think the operation went?
Of course, the operation went well. I've done more than 90 of these. It's standard procedure. I didn't even videotape it at the time. I didn't feel the need to. It was just another common procedure. I also reviewed my surgical operation notes, and I saw absolutely no deviation from the normal standard of care. And I truly believe, in both my personal and my expert opinion, I think that I met the appropriate standard of care. As a matter of fact, I know that I did.
Well, post-operation, how did Jamie's recovery go?
Yeah, and of course, this is the most important part, so that we don't re-injure the surgery area. So I referred him to a physical therapist that I've been referring all my patients to for years, Robin Stone. I had him report back after 6 weeks after the surgery. His healing was lagging a little bit, but his knee had a narrower range of motion than expected, but it was lagging a little bit, but it was still good.
Well, do you think his physical therapy went well?
I remember hearing about Jamie swimming around April or May, that he was swimming already. I got a little bit worried actually. I know that he shouldn't have been swimming that early. It would have been way too early for Jamie to be swimming. I heard that he was either exercising too hard or not at all in rehab. It was the recovery period. I don't think he was listening very well to me and the standard procedure. So there was a lot of compounding factors.
Well, when did you see him next?
Yeah, unfortunately, the next time I saw him, he came with another acute pain in his knee, and it was a retear of the ACL. And at that point, I knew that Jamie had pushed too hard in his recovery, and he wasn't following the standard protocol of rehabilitation.
Looking at it again, was there anything wrong with the surgery?
Honestly, no. I guess you can say that there was a slight error in the alignment of the graph. It was only 8.3% off. It's really this to this. It's not that much at all. I mean, nothing is perfect. I looked at my notes. Nothing went wrong. It shouldn't have been a problem if Jamie followed the proper rehabilitation steps. I 100% believe that this was the appropriate standard of care, and it would have had absolutely no effect on his recovery.
So, to clarify, in your expert opinion, what was the cause of Jamie's re-injury?
Yeah, it simply boils down to Jamie just trying to push his recovery too fast. He was exercising too much and got into the pool before he should have. 6 weeks. I said 6 weeks, don't get in the pool. He got it in 4 weeks. It's not good. And obviously, ultimately, his impatience was the cause of his injury that day.
Thank you, Dr. Ramidus. Permission to, no more questions. No further questions, Your Honor. Yeah.
May I begin, Your Honor? You once had a patient sue you for an ankle surgery, correct?
Yeah, a while back, yeah. That's right.
And you have performed over 90 surgeries, correct?
Yeah, so many. Actually, I'm not sure the number exactly. I guess when you do that many surgeries, that's what happens. But yeah.
Okay. And 48 of them on torn or injured ACLs, correct?
Yeah, exactly. I have a lot of experience with this type of injury. I've done so many recoveries.
So,
I've done so many like this. I've seen
it's
it so
a yes
many.
or no question.
Sorry, not yeah, but yeah, sorry.
So you know the difference between an autograft and an allograft?
Yeah, of course. Like I said, I know both of them inside and out. I know the procedure. I've researched them for years. In my residency also, we used to practice with both of them with like the practice dummy, which was pretty cool actually. We got to use the tendon, insert it into the new ligament.
Okay, thank you. And autograft uses tissue from the same individual, correct?
Yeah, an autograft, we actually take a ligament from.
It's a yes or no question.
But sorry, yeah, you're right.
And for an allograft, it takes tissue from a deceased person to create a new ACL, correct?
Yeah, we take a ligament from the deceased person and we clean it. We have to sanitize it well, of course.
It's a yes or no question.
Yeah, sorry, I'm sorry.
You said you recommended to use an allograft because it reduces the time of the operation, correct?
Actually, no. I recommended an allograft because Jamie is a pro athlete. He has a possible future in professional athlete.
Sorry. Is it your testimony tonight that you didn't recommend to use an allograft because it reduces the time of the operation?
No, that's one of the other parts of it actually.
So that's a yes?
Yeah, no, it's my testimony that that was not the sole reason.
Okay, and that an allograft is easier for you, correct?
It is easier, but that isn't the reason why I chose it.
And for Jamie, you use an allograft, right?
Yeah, I did.
But for an allograft, it needs to be placed at the 10 o'clock position, correct?
Yeah, 10 o'clock between 9 and 11, anywhere there, yeah.
10 o'clock, correct?
Yeah, 10 o'clock, 10:30.
an allograft at the 11 o'clock position, correct?
Yeah, say 10:30, 11
At-
o'clock, around there. The procedure went well otherwise if the standard rehabilitation
Sorry,
process was followed.
doctor. You
Sorry,
placed
yeah,
the
sorry,
graft
sorry.
at the 11 o'clock position, correct? It's a yes or no question.
Yeah, 11, 10.
It was 11
I
o'clock.
would say like 10:40, 10:45.
So it is your testimony today that you placed the graft at 10:45 degrees.
I didn't exactly like measure it or anything. I'm just saying around 10:45, 11:15, just around that.
But you stated that
Yeah,
you
around
placed it
11.
at an 11.
You're right,
o'clock.
around 11. Yeah.
And a wrongly placed graft creates instability, correct?
Yeah, instability, but that's why.
That's
we
a yes
do-
or no question.
Yeah, but we use the brace for this. We use the brace, the crutches, everything is.
That's
to
not
take-
what I was asking, doctor. I was asking if a graft that was placed wrongly creates instability.
Yeah, you're right. I'm sorry.
And
It does. Great, yeah.
And you are aware that the patient, Jamie, was a competitive swimmer, correct?
Exactly why we did an allograft. Yeah.
And you said that an allograft would likely be easier and quicker because Jamie's knees was in otherwise good condition.
Yeah, the muscles were nice and developed. The other tendons were perfectly tender. It was perfect.
But also an allograft is a little more dangerous. Is that correct?
I actually wouldn't say so. I think the other graft is more dangerous because you're actually making an incision somewhere else in their body to take one of the tendons, and then you're making another incision to open the knee, and then you're putting it in. So you're actually creating two openings in the body, risk of infection, risk of more injury. It's more dangerous to use the other thing, not an allograft, the other graft, to the ACL rehabilitation.
Right, and you use an allograft instead of the other graft because you wanted to make sure that it was the quickest, correct?
Not really, actually. I want, since Jamie is a professional athlete, he might be in the future, I didn't want to take another tendon. For example, if we took a tendon from his shoulder, for example, and then we took it from here, maybe the stability isn't going to be as good when he's doing the freestyle. So basically, I just didn't want to create some other type of confounding
Thank you,
variable.
doctor. But you are aware that using an allograft, Jamie's body might say reject that, correct? Because it is
Yeah.
from another
Yeah.
deceased person.
Yeah, actually, that's something I did a lot of research on, actually.
Well,
but,
thank you. You answered my question. Now,
Sorry.
let's move on to the after the procedure. You told Jamie to use the knee brace only when needed, correct?
After the initial like
Right.
4 weeks,
And-
then he can take his brace off. But as long as like there was minimal to no pressure, if he was doing some sort of lot of walking, I would recommend that he put his
Okay,
brace on.
doctor. And you told Jamie that he couldn't get right back into swimming competitively, correct?
Of course, no, definitely not.
You told Jamie to go to your recommended physical therapist, correct?
Exactly, my old reliable.
But you knew that Jamie was an athlete, correct?
Yeah.
And you knew that Jamie would go back to swimming after it healed, correct?
How could I know that? My job as a doctor is to confirm the surgery, and then I have to tell him what are the standard procedures for rehabilitation. How am I supposed to assume that Jamie is going to go back to swimming after 4 weeks instead of 6 weeks?
You just testified that you knew Jamie was an athlete, correct?
Of course, yes.
And he was going to be an athlete after the surgery, correct?
Yeah, of course.
And so, yet you chose the fastest procedure for Jamie, correct? It's a yes or no
The
question.
fastest procedure.
You just stated that an allograft is the fastest procedure.
Yeah, that I don't see what that has to do with this, but yeah.
Okay, thank you, Your Honor. No further questions.
Redirect, Your Honor. Dr. Ramidus, could you, just to reiterate, explain why you used the allograft over the autograft?
Yeah, I know. I just kept saying at the time, but actually the autograft, it's once I said 2 incisions. One at the site of where we're going to take the tendon from, and one where we're going to put the tendon. There is 2 injuries being opened up in this ACL rehabilitation surgery. So why would we create 2 injuries for a professional athlete? Of course not. I'm not going to do that. I recommended that we use a ligament from somewhere else, and we can put it in after sanitizing it, making sure that the blood types conform to each other so that it wouldn't reject the body. So we thought about this very carefully, and because of the fact that Jamie had possible pro athlete status, we had to we had to consider the idea of going for a more unconventional route such as an allograft.
And when placing this graft, 10 o'clock is the gold
Oh,
standard. But
Objection, Your Honor. Time's up.
That was 1 minute.
Sure. Yep. It's a stage.
Sorry.
You guys can have a couple minutes to prepare for your closings.
today's case is about impatience, not imprudence. Ladies and gentlemen of the jury, opposing counsel, Your Honor, we are not here today because of a surgeon's imprudence in his medical practice, but because the injured Jamie Morton was too impatient in his recovery and pushed his injury beyond its limits, effectively ending his competitive athletic career. Understandably, he was upset by this, but he decided to place the blame on an innocent man. And today, I will show you why Dr. Ramidus was prudent. See, the plaintiff is trying to tell you that Dr. Ramidus prioritized speed over safety, but what they fail to acknowledge is the fact that Jamie played a critical role in the damages that were allegedly caused by Dr. Ramidus. Because the truth is, while Dr. Ramidus' operation may not have been 100% perfect, it still met an appropriate standard of care. And the true cause of Jamie's re-injury were his own actions. Now, let's break down the claims the plaintiff is bringing upon Dr. Ramidus, and what burdens the plaintiff must have met in order for you to find him liable. They need to prove this to you by a preponderance of the evidence, meaning by more than a 50% chance. Negligence through medical malpractice is defined as a failure of a doctor to meet an accepted standard of care under the present circumstances, and that this failure resulted in the damages that pertain to today's case. This means that the plaintiff must prove to you two things. One, that the doctor was imprudent, meaning that they failed to act as a reasonable medical practitioner would in similar circumstances. And two, that this failure to act reasonably was the proximate cause of injury. This means they need to prove to you that Dr. Ramidus did not act as a reasonable medical practitioner would, and that this was the cause of Jamie's re-injury. And I'm going to walk you through why this is simply not the case and why the plaintiff will not meet these criteria. First, the plaintiff needs to prove to you that Dr. Ramidus did not act as a reasonable medical practitioner would, and that he did not exercise an appropriate degree of medical care. But that's not the case. Today, you heard from Dr. Ramidus that his operation did not deviate from a normal standard of care, that his use of an allograft was agreed upon by Jamie, and that this was not an abnormal course of action. And while his operation may not have been perfect, as the graft was off by 8.3%, in his professional opinion, he believes that this would have had negligible effect on Jamie. This 8.3% difference still falls under an appropriate degree of medical care, and you cannot find a doctor negligible simply because their operation was not perfect. Second, the plaintiff needs to prove to you that Dr. Ramidus' alleged lack of appropriate medical care was the cause of the damages. And again, this is simply not the case. You heard from Dr. Ramidus the reports that Jamie's physical therapist had given him. Jamie had gotten back into the pool too soon, and he was exercising too hard in rehab, or even worse, not following it. As Dr. Ramidus himself said, Jamie pushed himself too hard too early, and that his impatience was the cause of the injury. And that's indeed the case. You heard from Mr. Morton today that he wanted to get into the pool again as fast as possible, and that he was told to wait 6 weeks before getting into the water again. Now, he shouldn't have gone back swimming until around mid-April, but by mid-March, he was already going at it in the pool. And he supposedly explained that he wasn't swimming in the pool, but clearly, that seems to be not the case. So, Jamie had gotten back into the pool too soon, and he was exercising too hard in rehab, or even worse, not following it. And as well, you heard from Morton today that he wanted to get into the pool as fast as possible. And when he was told to wait 6 weeks before getting back into the water again, he was frustrated, and understandably so. He was frustrated with his physical therapist. He believed that they were not handling the situation correctly. And he took his own beliefs concerning his recovery over that of a professional medical practitioner, refusing to listen to the normal protocol that was appropriate for his recovery. When he was told not to exercise too hard or get back into the pool too soon, he thought they were just making a big deal out of it. And he continued to not listen to their instructions and continued to push his injury beyond its physical limits. And the plaintiff is trying to claim that Ramidus was prioritizing speed over safety, but it is clearly the opposite. Jamie was the one that prioritized speed over safety. And he was the one, by the way, that agreed to use the allograft that the plaintiff is trying to frame as being an inappropriate medical procedure by Dr. Ramidus. Overall, Jamie didn't follow the recommended rehabilitation procedure. And this is what resulted in his re-injury. It's an unfortunate story, but it is certainly not Dr. Ramidus' fault that it occurred. And that's because today's case is about impatience, not imprudence. Ladies and gentlemen, I ask you to find Dr. Ramidus not liable. Thank you.
Your Honor, may I begin? You just heard from Mr. Pemberton that Jamie Morton was reckless and impatient. But Your Honor and members of the jury, that is simply not the case. You heard from Jamie that he waited to get into the water until his leg was better. He was an athlete. He knew the severity of his injuries. He knew as much as he wanted to get back into the water, he waited until he was able to. He waited until his operation was healed. He did not prioritize speed over safety, but rather it was Dr. Ramidus who did so. But they decided to belittle one big part. They called it a slight error. Well, that error was a big one. You just heard from Dr. Ramidus that he put the graft in 11 o'clock position, not a 10 o'clock position. He gave a range of positions actually. But for an allograft, it needs to be precise or else it creates instability, which the doctor agreed to. The allograft was a mistake that made it easier for Jamie to re-injure himself. Dr. Ramidus knew that Jamie was an elite swimmer. He knew that he was going to swim after he recovered. Yet, Dr. Ramidus decided to race. He decided he wanted to take the quickest way out to get Jamie out of the hospital and out of his hands. You heard Dr. Ramidus state that if he used an autograft, that it would get infected. Would you trust a doctor to do that? You just heard Dr. Ramidus also state that he was only off by 8.3% in his professional opinion. But in that same professional opinion, he stated that he doesn't measure the degree of where he puts the graft. Would a reasonable medical practitioner do that? Would a careful medical practitioner do that? The unprofessional practice of Dr. Ramidus and his race of time costed Jamie his career. Your Honor, members of the jury, after hearing the imprudence and impatience of Dr. Ramidus, you have to find Dr. Ramidus guilty. Thank you.